Hi, everybody. Zach Perry here. I am the legislative chair for THAC, and I'm hopefully here to help educate you on some important healthcare issues that you might not be aware of. And we're going to do this every month and try to keep it, sort of 5 minutes or less. So let's jump in. Last week, I was at HIMSS, which is a health information management conference. So I was there along with 30,000 plus of my colleagues in the health information technology space. And there were some key themes that I wanted to share with you. First, interoperability is coming. So, what is interoperability? Interoperability is the idea that the government has been pursuing for a very long time that all of these health record systems, right? We used to have paper and now we have digital electronic health records. And there was this idea that digitization would mean that it would be easier to share records. And unfortunately, that's just not true yet. There's a lot of databases that are siloed from each other. And the practical implication is that every time we go to the doctor, we're filling out the same paperwork and answering the same questions. Interoperability would make that a lot easier for us. It would actually give us the ability to have our records um, in our smartphones and bring them wherever we were and just scan a QR code and those records would pop up, or even better, the doctor's office would get them automatically before our visit and we could skip all of the initial questions. That's important for individuals. It's important for population level care, right? So making sure that health information can be shared across health systems and used to analyze different root causes of sickness and hopefully start to improve outcomes. So interoperability, big theme. Second one, telehealth is here to stay. I won't talk about the pandemic too much, but needless to say, there were a lot of very negative things during the pandemic, but there were some good things, right? One is I think we all enjoyed not commuting as much, and I think that many of us are hanging on to that as a way to improve our ability to sort of improve the balance of work and life going forward. One of the other things was telehealth. Telehealth made it possible for people that couldn't be in person to get care. And so, two senators have introduced a bill to extend access to telehealth and allow Medicare to continue to reimburse for telehealth. And I hope that that would expand much more broadly. So, I think everybody sees a future in which telehealth is a very main part of how care is delivered in the country. The third one, cybersecurity incidents are on the rise, unfortunately. As the amount of healthcare data continues to expand, so too do bad actors who want to get access to it. So health systems are continually investing many, many billions of dollars into protecting our healthcare data. And that is something that I think we are all going to have to get a lot smarter on. Frankly, there's a lot more healthcare data outside the four walls of a healthcare institution nowadays, right? A lot of us wear healthcare wearables, right? We've got our Fitbits, our Garmin's, our Apple Watches, et cetera. Those are all, creating more healthcare data for us. And healthcare data that lives outside the four walls of a healthcare organization isn't covered by HIPAA. And most people don't really understand that. But the reality is, as that data continues to grow and sit in places where it hasn't historically been, how that is governed is a really big topic. So not just bad actors trying to get access to information, but also folks agreeing to terms and conditions where they're giving away their health data, right? We all know if you're not paying for the service, you are the product. And so a lot of us, most of us scroll through these huge terms and conditions lists. We press OK, we download an app, and we don't really know what happens to the data afterwards. So the FTC is supposedly the group in charge of policing data outside the healthcare organizations. But there's been another bill that was drafted, two senators led by Senator Cassidy, to create a commission to study healthcare data privacy in the country. And I think you're going to continue to hear more about that theme. And it's something that's very near and dear to me because I'm also the president of a HEOS, which is the Association of Health Information Outsourcing Services. And what we do is our member companies manage the anytime protected health information, right? Large medical records leave the four walls of a healthcare organization. Oftentimes, it's one of our companies that are actually doing that. So if you've ever called to request your own medical records, you might have thought somebody at the hospital or the doctor's office was the one processing that request, but oftentimes it's one of our member companies doing it on their behalf. So I hope you find those topics interesting. If you want to learn more about them, please reach out to me. I spend a lot of time thinking about them. Next time, I hope I can bring some more information to you. Tell me what you want to hear about, and we'll also talk a little bit more about some of the things that are going on in Texas. So for now, signing off. Thanks very much.